Hi, everyone. Thank you for joining us again on the Lights Too Bright pod or Bright Light pod, Lights Too Bright pod. Um, for those of you who are joining us again, like to thank you for joining us. For those of you who are new, please do like, share, and follow. Today's guest is a friend who I know really through the BCLA. We have common ground in dry eye space in that she does a lot of really good research into it and is nice enough to share things with me and answer my questions when I don't know what on earth I'm talking about. So I would like to introduce you to Dr. Sonia Trave Huarte. Hi, Sonia.
Hello.
Hopefully I didn't butcher that too much.
No, it was actually perfect. Yeah, very good.
No, I didn't practice. I didn't practice at all before. So I know you're on holiday. I know you've taken time to return to Spain. So I don't want to take up too much of your time. And but I would like to thank you for taking the time. To to start off with, for those of us who are listening, for those of the people who are listening, watching, what do you do now? What is your current role?
So my current role is a research associate, which means that I work at an academia at a university and I do research, different types of research on my field of topic, my topic, which is dry eye management. So different types of treatments, see when it would work, why not, and contact lens space as well. So anything to do ocular surface wise.
Okay. So being in academia, does that mean that you are also teaching, are you more real? Some researchers literally come out of their room, give one lecture, and then go and hide in their room again.
Yeah, that'd be pretty much me. My contract is full-time research. So I do some teaching here and there. So I'm supervising of clinics. So at the moment, what I do is I'm supervising and also seeing patients in the NHS clinic, which is an ocular surface clinic. And it's a teaching role, just one morning a week. So what I do is I see the first patient with the students, and then they see how I communicate, and then the students do the following patient, and then they follow the patient with the consultant, so they also see the management as well, so they see the
Okay,
whole episode. That's
that's fantastic. That's that's a good way to see it because you get the whole journey, and because we are allowed to say you're at Aston, aren't you? Yeah. So we're at the end. We are where you are now. And so I like to go back to the beginning and really I always like to start with, so did you always want to be an optometrist?
Actually, yes, weirdly enough. Since
Yeah.
I was probably 4 or 5, I had to be wearing glasses, so I was visiting the optometrist quite a lot. But also my grandma and my dad as well were wearing glasses. So if it was not me, it was them. So I was always like seeing them as I was growing old, and I was like, oh, this is quite interesting. The first time that I put glasses, I was like, how come something transparent makes you see clearly? And the curiosity in me and seeing the optometrist so often, I consider the optometrist as family. I always had the same one, and my family as well. So I think that's why I started developing that wanting to know more about it. Um, and actually, the optometrist said, it's a beautiful undergrad. You do biology, you do this, you do that, but you also have to work on Saturdays and sometimes some Sundays. So, it's entirely up to you. And yet I still pursued it.
So I say it's nice that you've said that your optometrist was like a family friend, it and that you'd seen one optometrist who'd had such a big impact, on your life really, because you've got career choice and someone who's probably remember seeing you as a little 4-year old and now as a 20 something year old. um that is great. So they would be your inspiration for optometry. No one in the family is an optometrist or
No, no, no. And no one's in a medical field. So I would say that, yes, she was my inspiration at a time. And actually, it was so close to us that I called her my cousin as a joke.
Yeah.
But
Yeah, yeah, yeah.
yeah, it's part of family pretty much. Yeah.
That is amazing. So, where did you do so what is the journey like? Because you grew up in Spain. What is the journey like for a Spanish optometrist?
So I did my undergrad in a faculty called FOT, which is Faculty of Optics and Optometry of Terrassa. I started there when I was 17 because I was like from October, so late. Uh, yeah, and then I did a couple of years in there. In Spain, it's a bit different, at least in my university. So you do optics and you do optometry. So it's almost like two undergrads in one. So the first year, 2 years, it's mostly like chemistry and maths and like pure physics. And then after that, you go more into optometry. And I've always wanted to know more about how other people do things and how other countries do things. So I found the way to go elsewhere to do an Erasmus Plus, and that really broadened my horizons. I contacted. I think I was in between Cardiff and Aston at the time, so I decided to go for Aston because they said at the time it was like one of the biggest ones with most students. So I said, you know what, let's go there. And actually just went there for 4 months. But I took 7 subjects, I think. And all my other Erasmus friends, they were like, "Oh, we're visiting here. We're doing like 1 day university." I was like, "No, no, no! I want to take all the exams. I want to see how things are done differently in this country." So I did subjects of second year, third year, and then at the end of that Erasmus Plus, I had two professors from Aston that said, "Oh, Sonia, do you want to do a PhD?" And I was like, I didn't even know what a PhD was at the time. Um, but yeah, then I went back home. I studied a bit more. I said, I don't, because in Spain, you need to do a master's before doing your PhD. And I said, just in case, I'm going to do a master's because it always gives you some more background in research. And so I did, also in the same university. And that was particularly on ocular surface and contact lenses. And luckily enough, I got to practice in a hospital, a private hospital, that they do a lot of different designs of rigid lenses and corneal peripheral lens clear. So it was a lot of contact lens design. And my dissertation was designing an ortho-K lens for presbyopia,
Okay.
and it was so fun. I had some patients that 4 years down the line, they're still wearing those ones, and they were like, "Hey, no glasses." So they're, yeah, very happy. And after that, when I finished that, I got an email from one of those professors at Aston that said, "Oh, I've got this topic. Would you be interested?" And I said, "Hey, a professor contacting you saying if you
Yeah,
want to
yeah.
do a PhD on the topic that I love?" I said, "Absolutely." And that's how then I moved to the UK and pursued it. That was 2017. And I finished right after COVID, so 2021.
Yeah. So that's amazing. I'm just gonna go back a little bit because I'm not even sure I know what the Erasmus Plus program is. And so I think it'd be interesting for anyone watching just to maybe understand that if you don't mind.
Yeah, yeah. So the Erasmus Plus is a student mobility program. You can do. There's different names from it if you do it nationally within UK. If you want to go from Bradford to Anglia or Cardiff or whatever where you want to go, but the Erasmus one is going within either EU or EU area, and that's what I did at the time. So yeah, you can pick which terms you want, which subjects, so that they align where to the same subjects that you are in your undergrad. So,
Okay.
yep. And then you can have either some grant funding from your government, from your regional council. It really does depend. But yeah, I think it's really good to see how other people practice in other countries and regions.
Well, that I agree. I agree with. I mean, I did my US qualification. I did my OD after I got just a bit bored working in the UK doing the same thing, and I'd always had an interest in oc disease, and I'd heard that if you go to the States, you can do a lot of oc disease. So that's what I did, and it was a real eye opener, no pun intended,
Yeah, no, no, yeah.
in terms of how optometry can practice and what we are able to do, you know, just above and beyond refraction, which I did a lot of. And I didn't particularly find it challenging at the time. So, but I get it. And I'm a big advocate now. If you get the opportunity to go abroad, either to live or study, and just get yourself into other people's cultures, it's it's really good. It's just kind of broaden. It's so good at like broadening your horizons,
Absolutely.
and I think also I think it really makes you kind of appreciate your culture a little bit more. Not necessarily your culture, but where you come from.
Yeah. Yeah.
You kind of go, you know what? I miss the stuff we take for granted as a kid in Spain, in England. When you don't have it, when and the US is not exactly very different, same language
Mhm.
kind of stuff. And you go there and you think, oh, they don't do this. This is weird.
Yeah.
Why don't they do this? And
Yeah.
vice versa.
Yeah, it's good because it really opens you up to different cultures, different ways of doing things. And I love learning about different people, different nationalities, different culture. And you do such a big growth without even realizing that even though for me it was 4 or 5 months, I went back and I'm like, it feels like things are still like nothing has changed. And I grow so much as a person that it feels like, well, from now on, I just want to keep doing this. I want to travel more. I want to meet more people. I want to study more. I want to learn more.
Well, you're definitely traveling more as I follow your Instagram,
Yeah.
and you seem to be all over the place. It's amazing. So, did you have to do like the equivalent of a pre-reg? Is there anything like that in Spain, or do you qualify and then it's straight to patients?
It depends. So
Okay,
when you a dissertation, at least when I did it, you can choose doing like a full-time dissertation, which is going to be like, almost like a year, or you can split it and do like half a year a dissertation and half a year clinical practice. And I said, well, I want those best of both worlds. I want to try and see what I enjoy the most. So that's what I did. And I fit my hours. And what I did is I worked at yet another private hospital, and it was they were doing lots of surgeries. Most it was mostly pediatric strabismus and surgery, and it was amazing. Like I learned so much about binocular vision that I almost went and did a PhD on that because it was so interesting.
yeah. I I mean, my view on BV is until you find the element of it that you like, it's really hard. So I didn't really like BV until I realized how important it was to sport vision. And I like sport vision. So when you can find those overlapping elements, why, you know, and why certain tests and stuff are good for one thing, and you're like, oh, well, this is amazing. I understand this now because I can put it into context. I don't know what it's like at Aston. I mean, and I've been qualified significantly longer than you have. But when I did BV, I didn't get it. Like I got it, but I didn't get it. If that makes sense, I was
Yeah,
like, I have no real interest in pediatrics. I don't really want to see children. It's not really my thing. So it was one of those things you just kind of tick the box to get through that exam. And when I went to the States and I learned it again, I was just taught it in a different way. And I still didn't think, my God, wow, I want to do BB. But I was kind of like, okay, so it makes more sense now. And I think it's tough when you're a student. At 17, when you're making those decisions, it can be tough to appreciate because in isolation, it doesn't make much sense. But then when you mix it with everything else, it can be huge in terms of decision making and things
absolutely.
like that.
Yeah. I think that for me, I've always liked kids. And when
Okay.
I tested kids, I feel like they were like straight to the point. You have some adults that they have 20/20 vision and they're like, yeah, but it's not clear. It's this. And the kid is like, that's a trait, or that's a broccoli. I've had that as well.
Yeah.
So it feels very genuine. You know what you're doing, and the results sometimes could even be clearer than what you have with an adult. The genuinity of kids.
Yeah, it's nice to find your passion. So how have you then gone from kids to ocular surface disease? Which, I mean, we know there's more ocular surface disease issues now, with with dry eye and tablet use and stuff like that. But how have you got that? You know, that's you've gone from a young population to a predominantly old population, which, I mean, you know as well as I do now, that is now changing.
Yes.
There's now a bigger overlap as we understand more. But even 10 years ago, you know, a lot of the data was like old females suffered dry eye. So how have you made that switch? Um,
I think first of all, it's like who is teaching you. I had two amazing professors. I had Janice and Karma back at the university in thought, and if those professors pass the passion on to you, it's just easy to learn. It's easy to love it. And then the first time that you get Slila and you start looking and you see the eye in 3D and the colors and everything, to me, it was like, wow, this is absolutely amazing. And that's something that I've always liked. And the fact that you can calculate the lens and change the fit, something that I adore. So what I did is that's why then on the masters, I was like, I'm going to try that because that's something that really sparked my curiosity doing my undergrad. And I it's not that I learned to love it. I loved it from the first contact lens module that we have.
I mean, that's it's really nice to hear that you found your passion early, because I think some people don't. Some people never find it, and they just kind of bat their way through it. But that was the idea of the pod, was to give people insight into different passions that you can have. The profession is really big, and it's quite diverse, and you can have an area that you're passionate about and really step into it and make a career out of it, you know, and which I think is really nice. You know, to go to your point that you did your Erasmus plus, you got yourself out there, you made friends, you made professional relationships, you know, you built those connections, to then have, you know, someone reach out to you and go, you know, how would you like to do a PhD? You know, that's really fantastic. And that's nice for those who might be thinking about doing a PhD, but are not fortunate enough to maybe be invited on to a program for whatever reason. That, you know, people change. Some people, you know, they go through university and they're like, just getting through university, and then something clicks, and all of a sudden they go, you know what, I really like this, but I didn't, you know, maybe I got a third or whatever, right? Just got through. What, you know, having been in the system, what is the other way of getting into PhDs? Do you have to be invited on, or is there an application process? Is there somewhere people would go to
Yeah, so
find these things?
I feel like my way is quite odd. Normally, there's different ways of enter. You can either you really like a topic and you're like, oh, I want to learn more about this, and then you can either contact universities or contact specific people that you know that they're really good in the topic, and you want to work with them. Or you can find positions. You just go at PhD, find a PhD, and you can move to countries. You can apply for grants. So there's no specific set ways. Obviously, you need to go through an interview process. I still had to go to an interview process. It's not, we're like you're going to get it. No, you really need to prep. You need to create a proposal. You need to understand what you want to do. But you've mentioned something that is quite interesting. I myself was not probably the best student as an undergrad, and I had some teachers reaching out to me later and saying, "Oh, Sonia, we didn't thought you were going to make it that far." And to me, it's not about grades. It's about being curious. So wanting to know more, but that is, I feel it's a personality trait. It's a way on how you approach life, not just studies. So it's that the wanting to know more. And another thing to mention is that PhD is completely different to an undergrad or a master's. A PhD, there's no classes, there's no exams. You just do you. You are, I don't want to say you're your own boss, but you control the time. You control how much effort you put in, how many patients you draw. It's all about your own work. The supervisor is just there to guide you, but they will not write for you, they'll not do things for you. So in the end is understanding, well, are you strong enough to hold 3 to 4 years if you do it full time, or maybe like double of that if you do it part time, to be able to do your clinical work, do your writing, do your reading, go to conferences? Are you strong enough? Because no one's going to pull you. You have to be there every day just doing this. Also, you need to keep your mental health. You need to work. You need to have a good diet. You need to go to sports. You need to be consistent in what you do. But specifically for your PhD, you need a lot of self discipline.
Okay.
And I feel like sometimes we might not have that, and we tend to leave things towards the end. So it's finding your own balance, and it's only you that can control that. So, not exams as an undergrad. You do have to defend your thesis at the end, which is quite a big deal. That one is. But yeah, it's completely different to anything that you've experienced before. That's why I say it's not like a certificate or a diploma or an undergrad. You read a lot, you write a lot, but no one's going to quiz you. And that's why associations and conferences such as PCLA, they're so important, because you get to talk to professionals, practitioners that they do things in the field that you do, and you get to then talk to them and be like, okay, so what I'm doing, it's all right because other people are doing it. So it's almost like,
Yeah.
okay, I understand. It makes sense. So very different, but very, very worth it.
I think that's probably the first time someone's explained a PhD to me. So I've always thought I knew what a PhD was, right? But no one's explained it to me in that way. You've gone, well, you picked it, you got to do the work, and no one's going to be holding your hand or babysitting you through the process. It's up to you to do the work and get the balance, life balance, and all of that things in place. I do think about trying to do a PhD, and after what you've just told me, maybe I'm not cut out for a
Well, I wasn't
PhD.
planning on that. I was just planning on raise awareness.
Yeah,
Sometimes, like myself, I just went into it because it felt like the right thing to do, and probably I didn't really know what I was getting myself into, but I loved it because I'm a curious person and I want to know more. So, but yeah, it's quite important that you pick the topic that you like and a supervisor that you like, and you have a good connection. That's key.
yeah, and I think that's everything, right? That's kind of a bit of a life thing. I think for those who are young in their career, and you are, for UK optometrists, well, for now, for the few that are left, who will have to worry about a pre-reg for a whole year. If you have a good relationship, it is definitely going to be of benefit to you. Um, I mean, you don't have to have a good relationship. At least with when I did pre-reg, it was just about a year. So I was lucky. I got on very well actually with my supervisors. But you hear horror stories of people just not getting on with their supervisors, and that turning into a tough year. So I get that. I get that being. Who was your CTIS supervisor?
My PhD
PhD.
supervisor,
Yeah.
Professor James Wilson.
So yeah, it doesn't get much nicer than James, really. It
Yeah,
just
I've been
okay.
lucky. It's also about knowing how to work and how to communicate, and how to keep that work balance. So he's a person that works a lot and get things done. So that's what I learned, and that's the person that I want to become. Like, I have my ideas. I want to get the things done. I get them done. Next thing.
Yeah. Oh, fantastic. That's nice. So you don't really see patients much, or
I,
do
I
you?
I do, I do, because for
Okay,
my all my
but you
studies.
don't teach much. So you don't teach much, but you see patients as part of your research.
Yes. So all of my research are with patients and different treatments. So I see patients pretty much every day. It's just that out of research, I only do the NHS clinic, but I still see patients. Yeah.
Okay. And is your research at Aston also, or do you work out of other sites?
No, at the moment it's just Aston. Yes.
Yep. And you are a expert in corneal confocal microscopy. Micros-
I tried my best. We do have
I
one.
don't I don't know anyone else who does. Well, actually, there's Scott does it at Moorfields, who I know.
Mm.
Um, but apart from Scott, I don't know anyone else who does it.
There's quite some across the UK, but some of them are used mostly for research and not that much for clinical practice. Some of them, so for example, at Aston, we do have the one, but we had another one, but it was used for animal models, which means that we cannot use it in humans, even though it's been
Okay,
sterilized. So I know that there's, yes, in Moorfields, there's, I believe in Mech, I think, Newcastle as well. So there's some scattered around, but the use, if we use it for research or we use it clinically, that's a different story. It depends on those patients that need that specifically.
yeah. And do you find that you've got a good balance between the studying and the patient side, or would you rather be more one than the other?
My current role is quite odd because it's not always like I have patients in the morning, then I study in the afternoon or I read. I might have 3 months back to back with patients and no time to read or write, and then 6 months of just crunching data sitting in front of my computer.
Yeah,
So it's different, and that's what I like. There's always something new. There's a new treatment, or there's a new study, or there's something sparking my curiosity.
fantastic. I am curious, but I'm lazy, and so I like to know new things, but I make lots of friends who can summarize them
Yeah,
in,
that's a different way
in,
to do it,
in,
but then that's not bad.
into bite-sized stuff. Or I will now I do like to stick things into Chat GPT and say, please summarize this for me, Chat GPT, into a bite-sized
Yeah, I
interest.
like doing that as well, but I have to say sometimes I had some answers that they're not completely correct.
Yeah.
So I don't fully trust it.
I don't fully trust Chat GPT yet.
It's
I
good to
do.
still have that clinical mindset of
I think you have to,
yeah.
because you don't know where it's pulled data from and how clinically accurate
Exactly.
that data is, which is, I mean, yeah. Well, I don't think there should ever be a point where a clinician is completely relying on someone else to make a decision, because
100%.
at that point, you're just a technician,
Mhm.
and you know, you don't need to go to university and get a PhD or master's just to be a technician, um, based on someone else's opinion. So, I mean, that's really really cool. Do you miss Spain then? Because you know, of everywhere you end up in Birmingham, so probably the most non-Spain like, yeah, no, most non-Spain like place in England.
Well, actually, I don't do well in hot weather. So anything more than 26, I'm like, oh my God, get me out of here. So I weirdly enjoy the temperature. I do miss the sun here and there, but the temperature, I'm loving it. So obviously, you miss friends, you miss family, and certain foods. I do miss that as well. But at home, Italian, Spanish, we're good cuisine wise.
Fantastic. So that, I mean, that's 30 minutes, Sonia. You know, you don't even realize that we've got here. It's been so nice to talk to you. I do like to leave with one question that I ask everyone, and that would be, if you had to give someone some career advice, and it doesn't have to be optometry based, it can be anything, to be honest. What would you say to someone within their career, who's maybe just, you know, just a bit bored?
Hmm I think that what I would say is just stay curious. It's, as I said during the podcast, it's not about the grades, it's about learning, which when you are in an undergrad, you feel like, as you said, you need to pass exams. But I feel like once you get into the experience and knowing more, seeing more patients or whatever the field that you are in, you start realizing, oh, why is that this way? And if you stay curious and you just want to learn more and deep down, that's for me the way that has opened so many doors in this field. Just don't be scared of asking questions. Just at the end of that lecture, go to that professor. Go to They appreciate those questions. They appreciate people listening. Who doesn't, right? So it's just about finding that inner child, let's say, why? Why is that? Why? And to me, that has never stopped. And because of that, I want to know more. And that can drive your career, that can change. It's not just the testing room. You can go onto a medical regulator, you can go professional affairs, you can go, there's consultancy. There's so many options that I feel like during university, you don't know because you feel like that's where you need to go. But if you stay curious, not just in what you learn, into learning about other people, you'll see that the career paths are so different. An example is your podcasts. It's wonderful to see what people are doing, what they're achieving. So always, to me, would be stay curious.
That is amazing. That is a beautiful way to end. And I would like to thank you so much for taking time on your holiday to speak to me today. And hopefully, we will see each other in person soon.
Absolutely. Thank you for inviting me.